streaming online at WURDradio.com. You can call us at 215-634-8065 or toll free at 866-361-0900 with questions for me or any of our guests. This program is brought to you by Community Hero PA, a nonprofit dedicated to helping African American women achieve equitable health outcomes, build financial stability, and lead change in their communities and beyond. Before we dive into today's main discussion, let's start with a quick check-in on our financial wellness, because health and wealth are connected at every stage of life, from pregnancy through raising a healthy family and retirement, and at really every phase of life. Joining us for this month's Financial Vital Signs segment is someone who knows a lot about building both. Please welcome Tynecia Wilson, the founder of My Healthy Wealthy Friend, where she empowers families to create financial legacies while building strong, healthy lives. A proud West Philadelphia native of Caribbean descent, Tynecia is a dynamic leader, storyteller, and advocate. With an infectious spirit and drive to inspire others, Tynecia Wilson is a vibrant force in her community, embodying the balance of health, wealth, and joy. Skilled in educational leadership, fitness training, she also has a bachelor's degree focused on Spanish language and literature from Temple University and a master's degree in advocacy and organizational development. Tynecia, we're so happy to have you with us today, and we are ready for your financial vital signs tip of the day.
Thank you so much. Hey, everyone. Can you hear me?
Yes, ma'am.
Cool. My name is Tynecia Wilson. The Healthy Wealthy Friend is what people know me as. I started this brand when I realized that our healthy habits save us a lot of money. Last year, I was able to lose 35 pounds, save an extra $10,000, and pay my car off 6 months early, all from these healthy habits. So today I am sharing one of my healthy habits that has saved me $10K last year, and that is keeping snacks in the car. So if this is something that you do not do, I highly recommend doing it. I literally have a few right here. I grabbed a few cuties that I like to keep in the car. I'll keep a pack of walnuts in my car as well. And this really helps stop us from this thing called instant gratification. So when we are hungry, what we want to do is to stop being hungry. And so we will pull into a fast food drive-through. We will stop at a fast food restaurant. We will do whatever we can so that we can satisfy that hunger craving. When you keep snacks in the car, you will not only satisfy that hunger craving, but you will give yourself just enough time to get home to some actual food that I hope is going to be a healthier option for you. So that is one of my many healthy habits that have saved me $10K last year. Y'all can hear more of my healthy habits on my podcast, the Healthy Wealthy Friend podcast, which is on Apple Podcasts as well as Spotify. You can also follow me on Instagram at the Healthy Wealthy Friend, and all of those healthy tips, as well as some other meal preps and just things that have really helped me live my healthiest and wealthiest life. I want that for all listeners and all audiences, so make sure y'all tune in.
Thank you so much, Tynecia. I'm sorry for missing
No
out.
problem. It's okay.
And we already have a caller, Ron from North Philly.
Yes.
Ron, are you
Hello.
there?
Yes, I'm here and I'm doing fine. It just makes me feel so good. At 82 years of age, I know you're talking about the females, but the health is so beautiful that we have healthcare providers like you and WRD throughout the years, constantly telling the people to get their health check up. And your program just remind us. And when I'm 82, and I'm doing real good, Mike. I don't have any prostate. I don't have none of that. I just have my legs is bad. But Jefferson Hospital, I always talk. I don't speak for the station. I really don't speak for the station. But they are aware of the programming on health from Jefferson Hospital and the University campaign. And I thank the station. I cannot thank them enough because a lot of times I hear things that I never thought of. And because of the station, I'm able to apply. So continue to get what you're doing. Because when you got good health, you have everything. And with the tedious stuff, when they talking about cutting back on our health care, I think people need to listen and take advantage of all the opportunities and then make calls for these people not to take away affordable health care. It means so much. So may all you ladies be blessed. If I don't speak to you, on Mother's Day, your mother, thank you, precious vessel, because y'all was the one that God selected, the vessel to bring us into this world. And when you're water bus, that was the baptism there. So have a blessed day. Thank you, ma'am.
Thank you so much. Thank you for calling in, and I received that blessing and well wishes. We're going to dive right into our program. We have Takiyah Durham with us today, and Takiyah, would you mind just introducing yourself so that our listeners know what your background is and where the well of information that you're going to pull from as we talk today about this important topic. Thank you.
Absolutely. I'm Takiyah Durham, the director of First Steps and Beyond, which is a program fighting maternal and infant mortality. A little bit about me. I've been in healthcare for over 20 years. Spent most of my career in women's health, but also family medicine and internal medicine, primarily looking at ways that we can foster better outcomes, but working directly with the providers, both in clinical roles and non-clinical roles. In addition to that, working in a nonprofit directly with high-risk pregnancies, and then also with individuals who were substance abusers, so individuals who were pregnant, going through mental health crisis. And then I'm very happy to be a part of this program, which is tackling maternal and infant mortality head on. So thank you so much for having me. I'm just one of the few people out of our Institute for Strategic and Social Workforce Programs, and I'm very happy to be here. Thank you.
Thank you so much. I know in Allegheny County, Black infants are dying at about 3 times the rate of white infants, and that's a heartbreaking disparity. And while First Steps and Beyond is based in Allegheny County, the disparities you're addressing are felt statewide. Can you share any statistics or insights on how the Black infant mortality compares across Pennsylvania and why it's important to pay attention to this beyond just one county?
That's a great question. So, and we just finished our PA Black Maternal Health Week, so I have a lot of information to tell you about this. When we look at Black infant mortality statewide, I want to go back to what's happening in the U.S. So no matter who you are in the United States, if you become pregnant, if you are an infant, you are at risk. So we have a bunch of resources. We have we have some of the best doctors, great technology, but still you're at risk if you become pregnant here. If we trickle that down to Pennsylvania, I'm going to go to Allegheny County first, then I'll jump over to Philadelphia. Allegheny County has some of the worst maternal and infant mortality rates in the country. If we go over to Philadelphia, the same thing, right? So if we look at Black infant mortality, if we look at the groups that are impacted at a higher rate, like I said, everyone's impacted. We want to make sure all women, babies, birthing people have favorable outcomes, right? But the groups that are impacted at higher rates, we have to pay special attention to because they're dying at, in some cases, 2 to 3 times the rate. So no matter where you go, Pittsburgh, Philadelphia, it is consistency when we look at mortality rates. And I'm talking about like the past decades. So it extends beyond Allegheny County.
Right, and that's the county where Pittsburgh is located.
Pittsburgh,
correct?
yes,
Okay.
yes, yes. So it extends beyond the Pittsburgh. I'm just going to say Pittsburgh.
Okay.
So it extends beyond the Pittsburgh area, which we primarily cover the Allegheny County area, but we have since branched out. But if you look at Pittsburgh and then you look at Philadelphia, we have Black babies and women dying in both areas. So if we focus our efforts statewide, we create a system where every family can benefit in Pennsylvania. And I want to touch on another thing. The Ebony Canal, I'm not sure if you're familiar with that documentary. Great documentary out of the Pittsburgh area. It is a outstanding documentary that talks about maternal and infant mortality. It is about data, stories, what's happening to our Black women, and it talks about the conversation that needs to be had. But the reason why I brought it up is because in this documentary, there are experts like Dr. Larkins Pettigrew, and we have folks from Philadelphia, Children's Hospital of Philadelphia, that talks about the same issue. Black women and babies are dying, whether you're in Pittsburgh or Philadelphia. And the one thing I appreciate about this documentary, The Ebony Canal, is Ime from the Pittsburgh area took it to a national stage at the Sundance Film Festival. And he amplified the voices of Black women by taking it to its first national conversation after the Black Maternal Health Week. And so what happened was, and I was actually there during Sundance, it was standing room only. There were people from all over the world. And one thing they said about the state of Pennsylvania is that although you guys are having very alarming rates, although you're Black women, birthing people, and infants are dying, you guys are spreading the word. You guys are saving lives. And so we had folks from all over the world look at the documentary and wanted to know what more could they do to support Pennsylvania. So that's why we have to take this beyond just one county, because this is about saving lives.
Absolutely. And I think sometimes the problem can be so overwhelming that you can lose sight of, where you're getting small wins along the way. So, okay, we're making some gains on the information campaign, and that's great to know that Pennsylvania is, I guess, a leader in that area.
And one thing I want to bring out, Ime actually won 2 Webby Awards, which is like the Golden Globe Awards for like documentaries and sharing stories. So this is a worldwide conversation now. So it started here within our state, and it now has taken like it's literally taken over worldwide. And so what we're going through here, Philadelphia, Pittsburgh, Allegheny County, the voiceless now have a voice. And this is why we need to go beyond our scope, beyond our counties and our cities to save lives.
Absolutely. I know that your initiative focuses on reducing preterm births, promoting safe sleep practices, addressing racial disparities in care, and supporting families during the 4th trimester. Can you walk us through how you tackle those areas and why each is critical for improving infant survival?
Absolutely. So we actually have a 4-pronged approach, which are vital for improving infant survival. So infant survival is the premise behind our 4-pronged approach. And so preterm birth rates. Every pregnant woman, birthing person, families, etc., need access to high quality prenatal care. We also look at advertising or advocating for birthing space. We look at strategies that will promote full-term pregnancies. We look at reducing the risk of preterm births. We have a program, I'm not sure if you heard about it, but it's Food is Medicine. And that program is to foster and also address any type of food insecurities that our birthing people have. So like if I'm a high-risk patient and I'm not eating right, or if I have diabetes, high cholesterol, high blood pressure. How will that impact my pregnancy? And so that's all within that preterm birth rate pillar. Safe sleep. Maybe I don't have a maternal issue, but perhaps I go home and I don't know that my baby needs to be alone on their back in her crib, or don't smoke around the baby. So we have initiatives around safe sleep education, disparities. So I'm going to talk a little bit about the CDC's data, because this is where I think a lot of what we do, you do across the state, all of our community-based organizations, this is the core of why we need to really move forward with advocacy work. If I am a birthing person, I should not fear going into a healthcare system. The provider is my partner, and I should go into a healthcare system where there's a partnership, it's free of bias, and we have a trusting relationship. So that bias pillar, disparities pillar, is to ensure fair access, favorable access for all families, doesn't matter who you are. And what that means is bi-directional trusting relationships with your clinicians, but also training the providers or anyone that touches a birthing person on what a successful birthing journey looks like. And so to date, we've trained, I lose count because the training has just taken off. We're in an 800. I don't like saying statistics when it's wrong, but we're in an 800 ballpark of individuals that we've trained. We need to, because if I really break it down, I'm telling you, we're really in the thousands. But I don't want my boss to get me, so I have to be super, super on point with this number. I know we're really in the thousands, but we've trained in the 800 ballpark of individuals who touch a birthing person on what that relationship should look like and how we should treat our people. And I'm going to go back to the CDC. In 2021 to 2022, we had our highest uptick of infant mortality, 3%, which was its highest increase in 2 decades. So if we put that into perspective, what that means is 2 decades ago, when we had less resources, the technology wasn't so great, it was safer to give birth than it is now.
That's crazy.
It is very crazy. Like I literally was on the internet like, okay, this is an error. This is an error. And then I heard the CDC say it like 20 times and then I really believed it.
Right.
But it's the truth. So you see the 3D imaging, you see all the technology that we have right now to save babies. We have excellent doctors. So why did that infant mortality rate go up? Well, the data is still being reviewed, but what we do know, it's about how you treat people. And so that disparity
technology is not curing that.
Exactly, that part. So disparities is super huge, and we do a lot of work around it. We work with patient experience teams, consuls, providers. We are so grateful for all the healthcare systems and clinicians that partner with us. And then the last one is our 4th trimester support. We'll be here all day if I told you everything that we do, but I will say this. There is a time period between the time I deliver a baby and a well child check, right? So we have a comprehensive program from a postpartum perspective where we look at breastfeeding. We involve fathers because let me tell you, shout out to fathers because I'm like, we cannot forget fathers. We have fathers, fatherhood initiatives, mental health services. There's so much in the 4th trimester support that we do. Infant mental health. When I heard about infant mental health, I'm like, what's going on with the infants? They get stressed out too. So there's so much that we do within the 4th trimester support to prepare our families to be successful. And that's why we have 4 pillars that we focus on. But maybe in another conversation, I can really break everything down. We'll be here.
Right. It's so much to cover in such an important topic.
Yes.
If you're just tuning in, you are listening to the Her Health Matters radio show on WURD Radio 96.1 FM and 900 AM. And we are streaming on WURDradio.com. Today, we're talking about the critical issue of Black infant health and how we can work together to ensure that every baby has the chance to celebrate a first birthday and beyond. We've been having an important conversation with Takiyah Durham from First Steps and Beyond about solutions, partnerships, and hope for our families. Takiyah's leadership and unwavering commitment to community service and maternal health have made a significant impact in Pittsburgh and beyond. Her work continues to inspire and drive positive change, ensuring that every mother and baby receives the care and support they deserve. So, Takiyah, getting back to today's discussion, is there a story that stands out, a family or a moment that illustrates the impact of the program? I know you touched on some of the numbers of people impacted, but can you lift the story up for us that helps to kind of humanize it for us?
This is a hard one because there's so many stories. Oh my goodness. So I'll start off with this and then I'm going to tell you, I'm going to try to pick one because I promise you. So when I first started this program, I'm going to do two because I really have to share these with you because when we do this work, we signed up to be a voice for the voiceless, right? That's what we signed up for. And that's what you and I are doing right now. So that's why I want us to come into this space right now before I share this. When I started this role, I met 11 amazing community advisory board members who lead our program. Each and every one of these individuals are mothers or birthing people who have shared their lived experience with First Steps and Beyond. They are the bravest women I know. We have shared tears. There were nights that we could not sleep after hearing their stories. Some have lost their babies. Some had C-sections that they did not want. Some were afraid to step in a healthcare system. Some had told me they would never, ever trust a provider again. Some had simply lost
Very heavily invested in this.
Let me tell you. So, and I literally, we sat with them and we said, give us some time. Give us time and hold us accountable. Mm-hmm. Because if we're going to be advocates and partners with you, and if we're going to be someone working with healthcare systems and providers, you hold us accountable. Because you experienced this in your birthing journey and you deserve to have a voice. And so I'm going to share two stories with you. One mother had a pregnancy loss, and she shared with me that she lost hope in the healthcare systems. She didn't like how she was treated. She felt that her pain wasn't acknowledged, her voice was not heard, and she did not think that years down the line that it would be successful or any ground would be made through any of this, because it was just really hard to navigate through the healthcare systems. Me, being in healthcare, working with amazing leaders like my boss, Veronica Villalobos, Dr. Larkins Pettigrew, folks, even in Philadelphia, I knew we can really pull this off, and even the doctors that we work with every day. So we literally let the community advisory board members lead First Steps and Beyond. We let them create different events, programs, and we put them in the forefront of everything that we did. I'm going to fast forward a little bit because you start to see the program evolve. They were interacting with providers. They were leading doula programs, pretty much putting doulas on the map and being a liaison between the providers and the doulas with some of our initiatives. They were at the patient experience listening sessions. We had leaders, and when I say leaders, executive leaderships at these meetings with the community advisory board. Yes, listening to their voice. And so when we talk about impact, and we talk about the community advisory board members saying, well, they need to come down and talk to us, they came. And what I will tell you is that we were able to create an alumni division because these individuals did not want to leave. So we have like a turnover where we get new advisory board members. They
Right.
end up wanting to stay with us because they saw
That's
the
great, though.
impact of the program. They saw the growth. We end up growing into a national brand, and we were able to bring providers, community-based organizations, and a lot of our partners together. And it's been an amazing experience. And we
Right.
met with them recently, and we've had individuals say, we feel we can trust our clinicians at this time. So
That's so
huge win
important.
for us.
If that's one of the questions that I was going to ask is how you ensure that the voices of community members are heard and incorporated into the program's initiatives and policies. But that was it right there. You let them take the lead, it sounds like.
Yeah. And you always have to. So you let them also hold you accountable. I'm going to tell you a true story. Maybe I shouldn't say this, but people don't always say things that are real. So it is what it is. You have to let them hold you accountable. So they actually evaluated our program. And they gave us some honest feedback that we looked at and like, oh, really? For real? Well, yes, it's true. And we had to correct some things. And there were some things we loved to hear. Everyone loves to hear great things. And there were some things there were areas of opportunities. We've had a lot of listening sessions. We did a lot of surveys. We had pulse point checks where randomly we would check progress. We had an open door policies with our advisory board members and our providers. And we had brutally honest conversations. One I remember, they told us, we're so tired of hearing about first steps and beyond. They're like, we know the first steps, but what about the beyond? Like, you guys are doing the first steps, but what about the beyond?
Right.
And I tell you what, that was the start of our 2025 strategy. And with the 2025 strategy, they were the reason why we were able to grow so quickly. We owe it to them because they were brutally honest on what they needed to see. And that is why you have to lead by a community-based model, because look at what happened.
Right. I mean, and you really laid out the story of how you rebuild trust in systems that have failed so many families in the past. You know, the stakeholders who help to guide and direct the programs really, like I was saying, are very heavily invested, have been personally impacted, and by really incorporating their voices and making it clear that their input was something that wasn't just hear and forget, but really to guide and direct. So you all have done an amazing job with that. From how you describe that, really is really a model, I think, of best practices. It sounds like, for how to build these types of programs. As you begin to expand into southeastern Pennsylvania, what are you most excited about as you bring Pittsburgh to Philadelphia, or southeast Pennsylvania, the Philadelphia area? What are you most excited about?
You know what? I would say we've already started to expand. So this is how fast the expansion is happening. Philadelphia is such a rich community when it comes to very welcoming partners, very welcoming organizations. I feel like home. I'm sure I'm speaking for everyone. We feel like home. So it feels just like you're at home, and we're just excited about the partnerships, the ability to save more lives, the ability to work with our family. It's like family. And what I mean by that is we're ready to look at the community. We're ready to look at where we can cultivate additional partnerships, where we could possibly have maybe another model like First Steps and Beyond, where we could support other folks, right? It may just be an opportunity to support other individuals. We've made contact with a lot of organizations in the Philadelphia area. You guys are doing amazing things. So at this point, we're just looking to grow partnerships. And it would be a phased approach. We want to test the feasibility of it. We want to look at what the model should look like from a pilot perspective. With your organization, we're already partnering on a vaccination initiative. That's important. That's huge. We've met with some individuals with the preemie program, and there's some other programs that do education in the Philadelphia area. So we are just looking at partnerships and what does that look like from saving lives. Rep Cephas from Philadelphia brought out about the 107 lives that were lost in PA. And to me, if one life is lost, that's too many. So we are just looking to say, hey, let's lock arms. Let's see how we can support each other. And let's do it today. So
Sounds
we already got started.
right. I mean, it's a huge elephant to eat, but it definitely sounds like you're taking a little bit more than one bite at a time. You're definitely making leaps and bounds. So I'm really excited to hear about that. As we kind of bring this segment to a close in, say, 2 minutes, what advice or practical tips would you give to Black mothers and families tuning in today, especially those navigating pregnancy, delivery, or postpartum care?
Wow, this is kind of personal, but I'll say this to all mothers, but especially Black mothers. You are powerful. You are deserving and you are loved. Trust your instincts. You deserve to advocate for your care. You deserve to have support for you and your baby. Build trust and relationships with your care team and your providers. Know your numbers. Know what resources are there. Connect with a doula. Hold your providers accountable. They want to be held accountable. I sat with the doctors, leaders at the top who literally ask, where is the problem? How do we fix it? How do we support you? They want to support you. Quality care should not be something that you ask for. That should be something that you get every single time. So prioritize your health. Do not be afraid to ask for it. Mental health comes first. It's your voice, your vision, your power. So remember that your journey is a partnership with your provider and your healthcare system, and that you are never alone because your care team is there with you every step of the way. That's non-negotiable. So if you have any questions, ask whatever questions you need, and know that all of us love you. We are out here being your voice. We love you. So do not be afraid to ask any questions that you need. We all have your back. That's the advice I can give them.
That love piece is so important. That I decided to kind of lift that and make that sort of the motto for my medical practice, a family practice that loves you back, because you'd be surprised how many people are just not feeling that or experiencing that, or just not realizing that they are loved. So lastly, how can our listeners find out more about your program and get in touch? Would you tell us how to reach out if people are excited about what you shared today and want to connect with you or your organization?
Absolutely. So you can go to our website, www.firststepsandbeyond.org, and there is a contact us link that if you have any questions, feel free to contact us. There's also additional information and resources. Another thing I want to bring out really quick, across the state, there is an action plan for maternal health recommendations for the state of Pennsylvania that we, First Step, worked on with a bunch of folks in Philadelphia. So there's a bunch of folks. Please take a look at it. It's through the Hospital Association of Pennsylvania. It is an action plan for maternal health. We will be uploading it on our website. I didn't get to talk about it. Please check it out. Huge, huge, huge document of information, but feel free to reach out to us if you guys have any questions. We would love to partner with you.
Amazing. So you heard it, firststepsandbeyond.org, right?
Yes.
Okay. So thank you so much for joining us, and thank you for the work that you're doing. It was a pleasure learning about the great work that you're doing. So continued success
Thank
and continue to
you.
save lives out here.
All
Thank you.
right. Take care. Bye-bye.
Take care. So now we are moving into our policy and women segment, where we focus on the systems and policies that shape our community's health and access to care. You are tuned in to the Her Health Matters radio show on WURD 96.1 FM and 900 AM, and streaming live at WURDradio.com. I'm Dr. Sophia Shabazz, and joining us now is Joanna Rosenhein from the Pennsylvania Health Access Network to help us break down some of the changes happening regarding Medicaid and why they matter to women, families, and communities across Pennsylvania. Joanna is a graduate of American University, where she studied sociology and education studies. She's passionate about issues involving economic and racial justice, specifically related to education and healthcare. Joanna came from working in education at Youth Build Philadelphia, where she helped facilitate job training and employment opportunities for students. Additionally, she has experience advocating for the rights of parents and students in New York City public schools with the Coalition for Educational Justice. Joanna is excited to be working with PHAN to support communities accessing their human right to health care and to expand coverage throughout Pennsylvania. When she's not working, she's enjoying reading, crafting, and finding good Philly food and music. Joanna, welcome to the show.
Hi, thank you so much for having me. Can you hear me okay?
Yes, we can.
Okay,
Thank you
great.
for joining us. We've heard that some in Congress want to add work requirements to Medicaid. What exactly would a Medicaid work requirement mean, especially for women and families who rely on Medicaid coverage for healthcare?
hmm Yeah, so implementing work requirements federally would terminate health coverage for millions of people across the country and, thousands of people here in Pennsylvania. It would mean that low-income adults who, are not disabled or who don't have other exceptions that the government decides on, will need to prove that they're working in order to be eligible for Medicaid. So this would impact really anyone who, might be in between jobs and, temporarily relies on Medicaid for their health coverage while they're looking for other work. It would impact caregivers, so people who are caring for children or maybe elderly parents. It would also impact people who, are fighting cancer and can't work because of their treatment plan. All of those people would be forced to purchase, private insurance at full cost because they wouldn't meet those work requirements. It also means that low-income adults who are working will be put through a burdensome paperwork process to prove that they're working in order to remain on Medicaid. We know that paperwork processes create more barriers to maintaining health coverage. Because, having more red tape really directly correlates to people losing access to benefits like Medicaid.
Right.
So it really creates a lot of problems for folks. We know that work requirements are not a common sense solution to the problems that Congress might be trying to solve.
Right. And it seems like such a it's a solution that gets you more of what you're trying to solve. If it's an economic issue, for instance, to take people's health care away where they then can't access primary care. I'm a primary care physician, a Medicaid provider, and it's already somewhat difficult navigating some of the red tape that is involved with people having to verify they don't have other coverage and other things that really get in the way of them being able to access their care, or really even for the physicians or other clinicians to provide that care and be paid for the care that you're doing. There's a lot of red tape. So this just seems like it would drive people to the emergency room, which would lead to more spending. It just seems very, very not only cruel, but counter to the objectives that you would think people are trying to meet.
Yeah, and it's just not a common sense solution to the problems. Making people more sick by denying them health coverage is not common sense. It will only make it harder for people to actually work if they can't access health coverage and maintain their health conditions. So it really is not a solution to any of the problems that we might be trying to address.
Absolutely, and it sounds like it's not just about who would no longer qualify. From what I understand, many people are losing coverage even if they should still be eligible. In fact, reports suggest roughly half of those dropped from Medicaid in Pennsylvania lost it due to these paperwork and renewal issues that you mentioned, not because their income was too high. Are you seeing that happen? And what can you tell us about what is happening even before these work requirements have been instituted?
Yeah, so just want to clarify, they haven't been implemented yet, so we're fighting very hard to make sure that they don't happen. It's just something that Congress has proposed. But we definitely do see, as it stands currently, we see so many people wrongfully terminated from their Medicaid coverage because of issues related to paperwork. It's a huge reason why people lose access to benefits like Medicaid that they're actually eligible for. And it's the main reason why work requirements would be so devastating. Because people who are eligible for Medicaid will end up losing their health coverage even if they are working, just because the paperwork will create that extra barrier. We run a statewide helpline where we help folks apply for health coverage through Medicaid, CHIP, and the marketplace, which here in Pennsylvania is Penny. And so we get a lot of calls from folks who are terminated from their Medicaid throughout the year because of these paperwork issues. Sometimes people just don't receive their renewal paperwork in the mail on time. Everyone has to renew their Medicaid once a year. And we often hear from folks that they will not get that renewal paperwork in the mail until the day before the renewal is due. So it subsequently means that their renewal is late and is submitted late and, their coverage is terminated. There are also a lot of documents that are required to be submitted with a Medicaid renewal. And it's confusing. People have to sometimes submit extensive documentation about who's living in their household, or, information about immigration status and things like that. So it is a huge burden for families, and it does mean that they're wrongfully losing access to coverage that they qualify for. And, it might result in gaps in coverage. Which means they won't be able to, pick up their medications, whether that's, insulin or an inhaler, or they might, miss a medical appointment.
I was going to ask what kind of health services might someone end up going without if they lose their Medicaid coverage. So you gave two examples there, not having access to life-saving medication, or being able to schedule an appointment with their doctor. These are really key services where I imagine these are people who would end up in the emergency room, correct?
Exactly. Yeah. If someone cannot pick up, their inhaler at the pharmacy, that means they're going without their inhaler. And we know that is a huge problem, and it could result in someone, ending up in the ER, which isn't good for anyone. It's not cost effective.
Or worse, if they get to the ER, because
yeah.
What would you say if you had to the message that you most urgently want people to know about what's going on with Medicaid in Pennsylvania, or changes happening at the federal level that will trickle down to Pennsylvania? What would you say would be the key bullet points, 2 or 3 key bullet points that you would want to make sure that our listening audience is aware of, and what to do about it?
Yeah. Thank you for asking that, because there's a lot going on right now federally with Medicaid. And I think the biggest thing that we want people to know is that Congress is currently trying to pass a bill that would take away Medicaid coverage from millions of people, really in order to fund tax cuts for the wealthiest Americans. And they're doing this through, or they're trying to do this through a complicated process. But what folks really need to know is that if these proposed changes to Medicaid go through, everyone who currently gets their health coverage through Medicaid could be at risk of losing it. And so we must be headstrong in really opposing any and all proposed cuts to the Medicaid program, and fighting to make sure that doesn't happen. And there are a couple ways that people can take action. The biggest thing that people can do is really share your story. If you are a person who gets their health coverage through Medicaid, or maybe you have a parent or a family member, or you're a caregiver for someone with Medicaid, the most important thing that you can do right now is share your story. And FAN is helping collect these stories and bring them to our members of Congress. So I can just let folks know that if you call our helpline and say that you want to share your Medicaid story, we can help you do that. And you can reach us at 877-570-3642. That's 877-570-3642. And you can just say you want to share your Medicaid story. You can also text us at that number and say you want to share. Or if you're just having issues with your Medicaid in general, you can also call that number and we can assist you.
Okay, that's awesome. So call or text. People are impatient in the text message society. So we'll be sure to include that in the show notes as well. That is key information, because many times people, they're hearing the information, but they don't know what exactly can they do to take action. I was going to ask if you meant like for people to go on social media and tell their story, but if you're collecting it at FAN by calling the number, I've forgotten it already, but we can make sure to post it and collect those stories, because so many people are impacted by this. And, are there things that a person could do right now to protect their coverage? What steps could someone take now to make sure they stay covered or to get covered again if they recently lost their Medicaid coverage? Do you have any practical advice on the paperwork, renewals, or resources to turn to?
Yeah, absolutely. So I just want to say, I know, the process is cumbersome and it takes a lot of effort, but we're here to help. So please reach out to us if you need help. But the most important thing that you can do really is to make sure that your address is up to date with the county assistance office. It's sometimes called the welfare office, so that you don't miss those important notices that you get in the mail. You can also sign up for a Compass account if you have Medicaid or other benefits, and you can get important notices on that Compass account. And if you are cut off from your Medicaid coverage, you have the right to appeal the decision. So just because you were cut off, that does not mean you're not eligible. It could be for so many different reasons. And so we always recommend appealing that denial if you are denied, and then reaching out, to us, and there are other orgs, but definitely reaching out to us at FAN for assistance if you want help navigating that process.
Awesome. What about for anyone else who's listening who wants to support their neighbors or advocate on these issues? What actions would you suggest they take? In other words, what can people do to ensure women, men, families in our communities don't lose access to the health services they need?
Mm-hmm. Yeah, so to help fight against the federal threats that are currently being proposed right now, we recommend calling your member of Congress, so your federal Congress member, and expressing that you're opposed to any proposed cuts to the Medicaid program. Like I said, sharing your story and just making it known that we can't afford to have any cuts at all to Medicaid. If you're assisting, a family member or neighbor who might have been, terminated from their coverage, again, you can help them make an account through Compass, call the county office to make sure they have an up-to-date address. And then if there are, denials that if you're trying to help folks get connected back to Medicaid, you can call us for that assistance as well.
Thank you so much, Joanna, and for sharing this important information. Would you mind sharing that phone number again And if there's a website that people can go to stay abreast and learn more about changes in Medicaid and how to reach your organization.
Yeah, so our website is pahealthaccess.org. You can reach any of our staff members there. We have our contact information. We do post updates. My name's Joanna again, so if you call our helpline, you can ask for me. And again, our helpline number is 877-570-3642. You can call or text that number, and someone will, get back to you.
Thank you so very much for the work that you and your colleagues are doing and for sharing this important information. So before we close out this segment of Policy and Women, I want to make sure to remind you that Pennsylvania's primary election is coming up on May 20th, 2025, and the last day to register to vote is May 5th. That's coming in hot. Judicial races historically see very low voter turnout, but these elections matter deeply. Judges are often the elected officials that you're most likely to interact with, whether it's through housing disputes, protection orders, public benefits, and so much more. I encourage you not only to vote, but to encourage at least 3 friends or family members to do the same. And we're nearing the end of our program with our last segment, Making Moves, where we share opportunities for health-related and community activities. So mark your calendars, because on May 17th, from noon to 4 p.m. at 700 Cobbs Creek Parkway, we'll be hosting our annual Community in Action Festival. This year, we're proud to partner with Speaker Joanna McClinton and are grateful for the support of sponsors like the Gift of Life, Pfizer, and many other organizations. It's more than just a festival. It's a chance to prioritize your health and your future. We'll be offering free preventive health screenings, financial resources to help build your financial stability, our popular Woosah area where you can enjoy a relaxing neck massage, a youth basketball and soccer clinic, a family-friendly open mic hour, and a special message from Commissioner Omar Sabir, and much, much more. Visit actionfestival.org to find out more or register your organization to have a table at the event. Again, that's actionfestival.org. So that is pretty much it for our show today. If you have a show idea, please reach out to us at communityheropa.org. This show is produced by Community Hero PA, a 501c3 nonprofit that equips African American women with knowledge and resources to take charge of their health, build financial stability, and lead in civic life. Through culturally responsive programs, we drive change at the family, community, and systems level. Special thank you to Nicole Keels Magruder, the executive producer of the Her Health Matters radio program and the founder and chief operating officer of Community Hero Action Group. We'd also like to thank WURD's technical producer, Rhonda Gibson. You can catch this episode and all previous episodes on our website at communityheropa.org. Join us next month on the 4th Sunday for another engaging episode. I'm your host, Dr. Sophia Shabazz, signing off. Until next time, be healthy, be you, because your health matters. Peace.